much. Good morning, everyone. And I have to say, it's a real privilege to be here and move from very productive discussions with academics over the last 2 or 3 years to taking a seminar out to the broad range of stakeholders who care about these issues. I think it's a really healthy dialogue, and thank you for all coming. I'll talk today about air pollution and health in developing Asia around this China-specific impacts and something known as the global burden of disease. And it's really following up on the previous presentation, which talked about control measures, backing up a little bit to talk about the rationale in terms of why we need to do this and why we need to be concerned about high levels of air pollution. This is a graph that in many parts of the world would be unfamiliar. Unfortunately, in China and in Hong Kong, it's really well known that most Chinese cities substantially exceed the WHO air quality guidelines and the Chinese mainland and the Hong Kong guidelines, as well as WHO at 20 micrograms per cubic meter for PM10, fairly stringent health-based guideline. Some of the things that have changed since 1990, between 1990 and 2010, the period during which the global burden of disease was conducted, included a real shift from a much lower population-weighted exposure to PM 2.5, now a 50% increase over the study period, reflecting migration and increased levels of air pollution. So the problem is getting worse, not just because air pollution is going up, but because more people are actually exposed. So given this problem, what are the health impacts of air pollution at these levels? And that's what the global burden of disease set out to evaluate. GBD was a systematic scientific effort to identify the magnitude of health loss from disease and injuries essentially around the world between 1990 and 2010. Cardiovascular disease, respiratory disease, HIV/AIDS, cancer, road traffic injuries, not unrelated to air pollution, but also the risks associated with those diseases: smoking, diet, high blood pressure, air pollution, overweight. Essentially, it looked at what we get sick and what we die from and the risk factors associated with those. Last completed with the WHO, by the WHO in the year 2000. The classic relationship, of course, would be something like smoking and lung cancer. The GBD was really unprecedented in its quality and its scope, and it was published in a special triple issue of the really prestigious journal The Lancet, something that had never been done before, given its importance. This was not a Western effort where Western scientists came in and looked at the global literature and made a pronouncement about what the effects were, but it really brought together almost 500 authors from over 300 institutions in 50 countries. In China, there were scientists from Fudan, from China CDC, Tsinghua, and others. So what are the GBD estimates based on, and why should they be credible to decision makers in Asia and other parts of the world for that matter? Well, first, they're based on some 50 years of air pollution science, going back to the Great London Fog. I talked yesterday about how only scientists knew about the Great London Fog and its relevance to science and health effects today, but now most people know about that, which is, I guess, a sad commentary, even as it motivates people, which is a good thing. But in the 50s, thousands of people died in the London smog, and since then, literally thousands of studies have occurred in the United States and Europe and elsewhere that have found associations of PM and mortality at very high levels, but also at much lower levels, down to 50 micrograms. Indeed, there's not a safe threshold below which effects are not observed. So the road ahead is quite long to get to really safe levels, but that doesn't mean we shouldn't be stepping ahead on it. There's a lot of Asian evidence that's come into play. This is just touching the surface with a 10-minute talk. This is a study of 4 cities, including 3 cities of Hong Kong, Shanghai, and Wuhan, which looked at acute effects of air pollution. When air pollution goes up or down on a particular day, you see a corresponding increase in death or hospitalization. And the message here is that in all 3 cities, and even in Bangkok, which is just slightly higher, we see a remarkably consistent effect of an increase of a risk of about 0.5 micrograms for every 0.5% for every 10 microgram increase in PM10. So as pollution goes up, the risk of death, especially among the older and more frail population, increases. What that does in studies like that allow one to do is look at Asia in a global context. Now, this is hard to read, but if you were to look here, you'd see that these are the 90 largest US cities, 20 of the largest European cities, cities in Latin America, cities in India, and the cities here in yellow in Asia. They've conducted time series studies, and apart from the individual results, what's important is the remarkable consistency. So what it tells us is the effects of air pollution are more similar than different, despite the many differences in population and pollution mixes. And global science can really be broadly relevant in terms of interpreting information for policymakers. For GBD, the global burden, didn't look at acute effects of air pollution, they looked at the long-term chronic effects. That's where the real damage occurs, although high pollution episodes are quite important. But the long-term effects, when people live in highly exposed areas for their whole lives, yield quite dramatic health impacts. And what this slide does is it looks at what were known as the GBD risk functions, the studies that GBD took into account when they calculated the global burden. And these are mostly Western studies in Europe and the United States, and there's always a danger in, well, are they relevant in China? These plots plot the GBD functions relative to the main China cohort study at the time, the CAL study, and you find a remarkable similarity in effect, again giving confidence that the global results are relevant in China. So given that background, given a very short tour of those studies, what did the GBD results tell us about information? One of the ways to understand it is to step back, look to 2000, the last time the GBD was calculated in partnership with the World Health Organization. And at that time, urban outdoor air pollution was ranked number 13. High blood pressure, tobacco, cholesterol were up here. Lots of things have changed in the world since then, and I'll explain a couple of what those are. But based on that study, one of the things that's happened is outdoor air pollution has now moved from number 7 to number 5 to 6. From number 13 to number 7 on the list of risks. And it's moved up to a position where there are now 3.2 million premature deaths worldwide occurring from ambient outdoor air pollution all around the world. This is the slide actually I was expecting next. This slide talks about what's changed. And one of the things that changed is there's been good news. People are living much longer. Standards of living around the world are improving. Access to health care is improving in developing countries such as China and India. There's been a dramatic improvement in sanitation. And so this graph depicts mean age of death in 1970 and mean age of death in 2010. And we find that basically every single country around the world is improving and moving up the curve, and people are living longer. With the good news comes an increased susceptibility of diseases of aging, heart disease, stroke, cardiopulmonary disease, lower respiratory infection, and things like lung cancer, which take a long time to manifest themselves. These are the diseases that are most associated with exposure to air pollution in a broad range of studies that have been done. Another thing that's changed since the last GBD is that there are new, more extensive global estimates based on measurements and remote sensing. So in the past, GBD and other analyses were limited to use of ground level monitors. And in that sense, they gave rise to solely urban assessments of air pollution impacts. What the advent of satellite monitoring, which is still developing but a very useful tool, has allowed GBD to do is to look beyond urban areas to rural areas where, for instance, in China, nearly 50% of the population reside, and to provide a more comprehensive picture of the health effects of air pollution. Given some of those changes, air pollution in China has risen to the number 4 most damaging risk factor behind dietary risks, high blood pressure, and tobacco. And when one looks at household pollution from solid fuels, which is just under ambient pollution, which is a rural risk for many parts of the population, and frankly also contributes to ambient air pollution. There's really a double whammy when you take ambient air pollution and you take household air pollution and you put them together. But just for the ambient alone, they told us 1.2 million premature deaths in 2010. A really serious problem. For my last slide, public health impact of air pollution is both well documented and substantial. GBD says that and identifies it as a very important factor of global public health. High levels of outdoor air pollution are responsible for 3.2 million premature deaths, and something I didn't get into, some 76 million years of healthy life lost around the world. In addition to mortality, as we're living longer, we're living in a poorer state of health with respiratory disease or other illnesses that really lower our quality of life, cut into the time that people go to school, missed work days, and lost productivity. So that's also a major issue. Developing Asia and India and China bear over 2/3 of the worldwide health burden. 60 years of Western studies provide an increasing base of confidence that the GDP results around the world are relevant, and the Asian studies corroborate that. And there are health, economical, and ecological reasons to take actions. And just in closing, typically the actions taken to reduce air pollution are among the most cost-effective of any environmental regulations that have been taken in most places around the world, with an order of 20 to 30 to 1 ratio between cost of compliance and benefits. Thank you.